Hi, everyone. Welcome to Ask the Expert. I'm with Dr. Stiles, Assistant Professor in the Department of Plastic Surgery. And I'm just here to talk about, breast implants and breast lifts. And so, Dr. Stiles, can you kind of tell us what are like the benefits of each procedure? Like, who would be a good candidate for each?
So that's a fairly common question that we get because a lot of times, especially after pregnancy, women have complaints that their breasts just look saggy, that they don't have enough volume. And so the question is whether they need their breasts lifted or if they need an implant, or maybe they may need both, where they need a lift with an implant. So for women who just need to restore some volume, but their nipple is in the right place, usually an implant does the right job. Women get into a lot of problems when their nipple areolar complex is too low, and then they just try to use an implant to lift the breast because all they wind up doing is getting a bigger version of the breast that they have. Now, sometimes what happens is women have a really good amount of breast volume, but they lack fullness in what's called the superior pole of the breast or the top of the breast. And so they just feel like everything is just low and heavy. And for those patients, just doing a lift alone gives them that fuller look and a lifted look, and they don't need an implant. Well, but then there are some women who have lost volume over time, whether that's from pregnancies or changes in their weight, and they actually need a combination of the volume that you get with an implant and the removal of skin that you get with doing the lift.
What are the biggest differences between all these different types of implants?
Women can have a good result with either a saline or a silicone implant, but it depends a lot on their skin quality, how much breast tissue they have, and how they want their breast to feel. So a saline implant will typically give a firmer feel to the breast. The other problem with saline implants is that over time they can deflate and then women will experience rippling. With the new cohesive gel implants, rippling is a lot less common, and the silicone implant gives a much more natural feel. So silicone implants were reintroduced to the market in the United States in 2006. And since that time, I would say approximately 98% of the implants that we put in are silicone versus saline. Silicone implants tend to have a much more natural feel. We also have multiple styles of silicone implants now where we can really customize the look of the breast augmentation for the patient's body type.
And then what would you say to like a young woman who's looking into getting breast implants? Like, should she wait, or what kind of advice would you give her?
Young women who are uncomfortable with the size or shape of their breasts should really consider breast augmentation around the age of 22. The breast can still change just from a developmental standpoint until age 22. And some women will suffer a loss of confidence and self-esteem because they feel very flat-chested or they can't wear bathing suit tops or workout tops because they just look too flat. And then sometimes when they try to supplement with implants on top of their breasts, they can have implant malfunctions that can really be embarrassing. And so, I think it comes down to a point where the patient feels they're ready to make a change in their body.
A woman who's ready to, get a consultation for either breast lift or breast implants, like what's the next step?
It's important to research your surgeon. Don't just go by what social media says or who your friends went to. Make sure that your surgeon is board certified. And when you go for your consultation, make sure that you feel comfortable, that they understand your goals, and that they will take care of you postoperatively. If there's a problem, that you have a place to go and nurses who will respond to you.
For the woman who's ready to take the next step into scheduling consultation for breast lifts or breast implants, what would you tell her?
It's important to choose a physician who is board certified in plastic surgery. When you go to your consultation, make sure that you have an idea of what you would like your breasts to look like. When you have your consultation, make sure you feel comfortable with the surgeon and with their staff. And I think the Vectra imaging system is key to helping them understand what your ultimate goals are.
Okay. Well, thank you, Dr. Stiles.
Sure.
If you want to learn more about cosmetic breast surgery, click the link in our bio or go to utswmed.org.